rules of 60. You said by the laptop, honey. Oh, where's this? I think Ashley took the sign in, but we will set it there and we'll get it here in a minute on the first break. All right, now we got to go over the rules of 60, so you remember. All right, now, in the rules of 60, when do we hold digoxin?
Below.
So we hold dig or lanoxin, we hold beta blockers, and we hold calcium channel blockers if heart rate is less than 60. Real quick, when do you hold Synthroid?
Above 100.
That's right. If normal heart rate is between 60 and 100, then anything that speeds up the heart, you would hold if it's above 100. Anything that slows down the heart rate, you would hold if the heart rate's less than 60. And Synthroid is giving that person metabolism. All right, so that would raise their heart rate. If your MAP goes below 60, you're killing nephrons in 20 minutes. That means any time that your blood pressure is below the mean arterial pressure. Do you know how to calculate your MAP? Diastolic plus systolic divided by 3. So if you have a blood pressure of 90 over 50, you would say 90 plus 90. Oop, my bad. 50 plus 50. We would do diastolic plus systolic divided by 3. That gives us a MAP of 63.3. That is the average pressure coming to and from the heart, filling the heart and being ejected from the heart. It's MAP is an incredibly important concept that is tested all the time in various ways on Nclex. MAP, have you ever been in a shower, washing your hair, and somebody in the house flushes the toilet? And then the water pressure drops, and there's not perfusion to the shower head, and now you can't get the soap out of your hair. So think of blood pressure like water pressure. If you have that water pressure or MAP go below 60, you don't have enough blood pressure to perfuse your kidneys. You don't have enough blood pressure to perfuse your brain. So that's why, what is the normal MAP? What should the normal MAP be? 70 to 110 millimeters of mercury. So if it is below 60, danger, Will Rogers, danger. You're going to kill your brain and your kidneys. You don't have enough perfusion. All right? We'll have to get some chairs from another room. Oh, no. Oh, sorry. Nclex review.
Okay.
All right. All right, so diastolic plus systolic divided by 3. How I remember it's 2 diastolics is if you're playing dice, you roll 2 die. All right? Not 2 systolics, it's 2 diastolics to calculate. So if your MAP is 63.3, my priority action would be to hold any medications that decrease blood pressure or remove fluid. What are the 3 things that give us blood pressure? There's only 3 things that ever give us blood pressure, and we're going to go over every cardiac med that deals with them. The diameter of the lumen of a blood vessel. If it's dilated, blood pressure drops. If it's constricted, blood pressure rises. The amount of fluid in here. If you're bulging with fluid, higher blood pressure. If we give you Lasix or you're dehydrated, lower blood pressure. And the heart rate is the pump pushing it all through. The higher the heart rate, the higher the blood pressure. The lower the heart rate, the lower the blood pressure. Every cardiac med we're going to go over. Who likes pharmacology here? I love pharm. Love it. Because I finally get it. It only took 38 years. All right? And my goal is not just to have you pass your Nclex, but it is to have you cut 5 years off your scary curve of learning, okay? So every drug we're going to go over when it comes to blood pressure to either raise it or decrease it, either dilates or constricts, adds fluid or removes fluid, increases heart rate or slows heart rate. You don't have one cardiac med on the planet that does anything but those 3 actions. But we make it more complex, and it doesn't have to be, okay? And we'll be going over all that. Now, the next thing about 60 is on your ABG, if you have a PaO2 of 60 or less, that defines respiratory failure. So when you're looking at an ABG and your oxygen's under 60, that right there, respiratory failure. Ding, 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 call the doc, get it rolling, okay? See, maybe this marker will clear it. Still wants to just hang on the board, doesn't it? Now, we're going to do the rules of 10 to 20. to 20. Your ICP, intracranial pressure, is 10 to 20 millimeters of mercury. Normal pressure for Nclex. Your IOP, intraocular pressure. The eye is the most outer part of the brain. So anything that, if you have a glaucoma question, if anything that increases ICP will increase IOP. So one of the primary interventions for anybody with glaucoma is give them prunes. Have them to keep hydrated. You don't want them constipated, because when they Valsalva, you increase ICP, you increase IOP, and you can cause retinal damage. So all the rules of ICP apply to IOP. And you have to remember that when it's a post-cataract surgery question, or they have glaucoma. Another thing, your therapeutic phentoin, I know I didn't spell that right, phentoin level, which is dilantin. You do know you need to know the generic names, right? So I'm going to be trying to throw out the generics as much as we can. They removed those in 2013. You no longer are given both names of the drugs. You only know generics. And in the rewrite in 2016, they're not increasing the acuity, but they're adding more alternative medicine and cultural competency and some nursing informatics stuff with computer, HIPAA. So everything, and right now, I got 98% of the people who are doing this passing their Nclex, the way I'm teaching it. So I promise you, and if you don't pass, you get with me. We will do an intense program of, what's the problem? Because I'm not just up here going, wah, 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 wah. I'm explaining concepts so you can understand them. It's up to you to bring to the table, though, studying them. All right? Now, 10 to 20, your therapeutic theophylline level and aminophylline for asthma. Now, when we're looking at, let me see, let me click. I should have one of the students up here clicking, I guess. I don't think it'll reach. It's plugged in. All right, rules of 3. If you take your PT times 3, you'll get your PTT. Because if we look at our clotting cascade, we have all these clotting factors, and then we make a partial prothrombin time. And then we add more clotting factors, and we make a prothrombin time. Go thrombus, go thrombus. Then we go ahead and we add platelets, and we make a clot. Now up here, what is your PT-PTT measured in? Is it milligrams, deciliters, seconds, minutes? What's it measured in? Seconds, because it's a bleeding time, isn't it? It's about how many seconds does it take to make a clot. So this right here is high up in the clotting cascade, so you are further away from making a clot, your PTT. So your PTT will always be a bigger, higher number than your PT. If you take your PT times 3, you will get the PTT. All right? What drug works here to stop clots? Heparin. What drug works here to stop clots? Coumadin and Xarelto. What's Coumadin's generic name? Warfarin. What is warfarin?
Blood thinner.
It's a blood thinner, but it's rat poison.
Oh, that's right.
It is rat poison. I don't know what idiot went out into the barn on the farm, saw the rats bleeding out their anus and their eyes and said, let's give some of this to people. I mean, that's kind of stupid. What common tea thins your blood as well as Coumadin?
No, it was
Tea.
Tea. It's chamomile.
Chamomile. Chamomile tea thins your blood as well as rat poison. So if you drank 4 to 5 8-ounce glasses of chamomile tea a day in a fib and had your PT checked every other week, you'd be fine. But you'd be off the rat poison. Just saying. Alright? Hemoglobin times 3. If you have a hemoglobin of 10 times 3, your hematocrit will be 30. That's in the rules of 3. Hemoglobin is the amount of iron that is on a red blood cell. We have red blood cells, and oxygen binds to that heme. So this measures the amount of iron. This is a percentage. Hematocrit, we take blood, put it in a centrifuge, and spin it. Just like that ride at Universal where it slams you up against the wall and the floor goes away. They're centrifuging. And then it shows what percentage is plasma, what percentage is red blood cells. So if we take our, if you're looking at expected findings and you know you have a hemoglobin, do I have black everywhere? Yeah, all right. Then we know that our hemoglobin is 10, that we would have a hemoglobin of 30. A crit of 30. Okay. Why are we not looking? And we did 24 and 48 hours. Now the rules of 5 to 15. For test purposes, BUN and creatinine is 5 to 15. If you just insert a decimal point, you've got your creatinine. It's the same numbers. Do you see that? Mm-hmm. I like to try and keep things the same because it's easier to remember. In our clotting cascade, what stops the platelet formation? Aspirin, salicylates. Plavix does not stop platelet formation. Plavix will let you have a normal platelet count, but it changes the membrane on the platelet. So aspirin goes to the bone marrow, stops the stem cells from becoming platelets. But the platelets usually are sticky like Velcro. You get Plavix or Ticlet or Integralin that changes the platelets so they're slippery now. Okay? So if we take a 5 to 15 and insert a decimal point, that's our normal creatinine, our normal lithium level for bipolar. We all know a few of those people, right? Who are unmedicated. I know. When I read mental health, I'm like, oh my God, this is like a family reunion. How many times when you're in nursing school, you read something, you're like, oh my God, I got that. I'm dying. And you diagnose everybody in your family. Digoxin level should be 0.5 to 1.5. Greater than 2 is you're heading towards toxicity. Dig toxicity. All right? This is so slow. 5 to 10. Do you guys know what your central, now, I want to, that CVP is in water, centimeters of water. So let me clarify. What is CVP? When the blood comes back from your toes, it's deoxygenated venous blood. It comes up through the inferior vena cava to the superior vena cava, dumping into the right side of the heart. The amount of venous pressure returning to the right side of the heart is central venous. In water pressure, that's what it is, but it's 2 to 6 in millimeters of mercury. So you have to know what units you're talking about, okay? Normal white count is 5 to 10,000, right? 5 to 10,000, your normal white count. Carbazepine, which is Tegretol for seizures, and we use Tegretol in mental health, that is 5 to 10. And gentamicin or deramycin, which is an aminoglycoside that we use in elevated liver enzymes, which we'll be getting to, in hepatic encephalopathy, 5 to 10. Now we're going to analyze each question the same way. We are not going to add evidence to the stem of the question. Every question we do, we're going to say, is this positive or negative, to do or not to do. We are going to look at key words. Let's finish going over what are key words, because we got distracted with tooting horns. All right. Key words or clues, we said are age. We said timing. How about where are you? And we got to look at the terminology too. They will not say doctor's orders. They will say health care prescriptions. All right, health care prescriptions. So if we have, and I always think of a prescription as something I go to Walmart and fill or Walgreens. So they will not tell you doctor's orders. They will not say doctor at all. They will say health care provider. Because it could be an NP, it could be a PA or a doctor. They will not say CNA, PCT, nursing assistant. They're going to say UAP, unlicensed assistant personnel. And then we're going to go into our national scope of practice, what each and every one of them can do. The new Nclex just changed. UAPs can't do blood sugars. No more on the Nclex. No more, because they get done wrong. They don't let the alcohol dry. They stab it and they use the first drop of blood instead of discarding it and using the second. So we've been giving the wrong doses of insulin. So even in Florida, UAPs do Accutrex. And it used to be, for the Nclex, a UAP could do Accutrex, but not on anything acute like an insulin drip. And now, that's going away. You do not delegate it to a UAP. They just changed that for 2016. All right? Where are you? Can a UAP pass meds in the hospital?
No.
But they can in home care. So where you are in the stem of the question changes your answer. That's what you got to do. Where am I? Because if you're in home care, they can hand grandma her beta blocker all they want. Right? Another thing is, we said gender. The disease or diagnosis is key, because that's part of your clues as to what you're looking for. Another thing is the treatment, because we know if you're on chemo, well, that's going to decrease your platelet count, you're going to be at risk for bleeding, chemo decreases your white count, so you're at risk for infection, and we'll be going over chemo, and chemo decreases your red blood cell count, so you're exhausted, you're anemic. So we have, that's why treatment, we have to know, if you have an ectopic pregnancy and they give you a shot of methotrexate, last I knew that was chemo. So all the rules of chemo apply to teaching that girl as she leaves the ER. You're going to be immunocompromised for a couple weeks. Skip going to the mall, especially during cold and flu season. You may notice some more hair in your brush this week. That's normal, don't worry. You might even get stomatitis. You know what stomatitis is? If you're on chemo, it stops the GI lining from replicating because it stops all fast-growing cells. So you end up with like canker sores in your mouth. Stomatitis is we get stomatitis when we have chemo and when we are an end-stage renal failure. So how they ask that is they say, okay, you have an end-stage renal or a chemo patient, what you going to feed them for breakfast? Won't be orange juice unless you're a sadomasochist, because that hurts. You're not going to give them salty bacon or a crispy, crunchy English muffin to tear up their mouth. They're going to get cream of wheat and learn to like it because they have sores in their mouth. See, what it is the Nclex is not memorization. It's application of knowledge. It's connecting dots, okay? And if you're a Sunco student, you can sit in every month when I do a review, you're in here for free. Because I'm running the place now, okay? So, and we're going to take that pass rate and double it in 6 months, all right? Another thing here, any lab values are key, and any meds. I would say labs or tests they give you. They're the clues in the stem of a question you want to pick up on. That is the important stuff. Everything else can be superfluous, okay? And of course, if they give you vital signs. So we talked about to do or not to do questions, that if you're not to do it, then you better be, talk about keywords. Where are you? Lab symptoms. Now, and we already did this one about an elderly white woman, and if it's, then it would be osteoporosis if they're skinny, right? And then if they were a young person, then just changing the age would make you go for anorexia. All right, let's see, a 24-year-old male with an appendectomy 2 days ago. Pain is 2 out of 10.
I'm sorry, I know you're recording, but we have to. Is anybody parked in front of the nail salon?
Is anybody parked in front of the nail salon?
Anybody?
Because they have to move.
Well, I just had a distressing call from Daphne, and then Lori's involved.
Okay. Is anybody out here
Anybody?
parked this way? You have to move.
Well, outside.
No, the nail salon, like right in front of it? Okay, because the student also was very rude to the owner, so.
All right. All right. Now, if you are a 24-year-old male and you had an appendectomy 2 days ago, your pain is 2 out of 10. The site is erythemic. What's that mean? Red, swollen. Serous pink drainage noted, pulse 60, BP 118/68, pulse temp 101, respirations 20. Your priority nursing intervention is. So is this a to do or not to do? To do. So we're looking for a right answer. Yes. So here, our key words are 24-year-old male, appendectomy 48 hours ago. Pain, vital signs, and look at that temp. So do you contact the healthcare provider about the wound erythema because that indicates infection? No, within 2 days we cut you open, it still will be red, right? What about a temp of 101, 48 hours?
Yes.
That now we're thinking infection. If they have pain 2 out of 10, that's normal when we cut you open. And if the pulse is 60, that's still within norm. So we would go ahead and contact the doc because of the temp. Now, they can only ask you questions about 4 different areas. Scope of practice, which is what we're going to attack first. That means, what can a nurse do without a doctor's order? What can an RN do without a doctor's order? Nothing.
Yeah.
We can teach till our tongues fall out. We can assess with our stethoscopes till we have bored a hole in our head. And we can do range of motion till our patient's limbs fall off. We can flip them like pancakes too. But we can't do anything invasive without a doctor's order. So have you guys ever taken questions in a test and the instructor says, well, assume you have an order. But that makes you fail Nclex. Because that's one of the areas they're going to test you on. What can you do? Now, if they give you a scenario that you're in an ER or an ICU and someone comes in chest pain and pick all that apply and all the interventions or apply oxygen, morphine, nitro, You do assume you have an order in an ER or an ICU because aren't we always covered under standing orders? But if you're in home care, med surge, tele, ortho floor, you got nothing. You must call the doc about everything. So a good test-taking strategy, when you're just SOL, you might not even know what the word is in the stem. OMG. I don't have a clue what this is. Look at your options. Look at A and say, can I do you without talking to, because this says priority nursing intervention. You want to say, can I do you without talking to a doc? Can I do you without talking to a doc? Can I do you without talking? Oh, I can do you without talking to a doc. Because it said priority nursing intervention. How many of you guys have a care planning book? How many of you love that care planning book? Do you know all the answers to the Nclex are in that book? Every nursing intervention, every nursing diagnosis, every pathway to success on the Nclex is in that flipping book. Because every question on the Nclex is a level 1 nursing diagnosis question. What's your priority nursing diagnosis? So what you ought to start doing as you are going through concepts, looking at liver, pull out, dust the puppy off, and open up. It has to be a NANDA. Nursing, because that's your national, all right? These are National Association of Approved Nursing Diagnoses. And the Nclex uses them. And for every, if you look up liver failure, then it'll tell you all the nursing diagnoses. And then for each diagnosis is every intervention that we're allowed to do for that. So as you're studying, I would start pulling that puppy out. Because you need to know. They test you on care planning. And they're going to say, what's a priority nursing intervention? That means what you're going to do. Are you going to assess? Are you going to teach? All right? So now in scope of practice, RNs can do anything nursing. Not medical, nursing. What I mean by that, do you guys know what epiglottitis is? It's where the epiglottis is getting swollen and it can slam shut. And it says you have a patient comes into the ER with stridor, drooling, and tripoding. You suspect bacterial epiglottitis. What's your priority intervention? Nursing intervention. Is it to intubate? Is it to do a throat culture? Is it to get a tongue blade and assess the throat? Or is it to have a trach set at the bedside?
Trach set.
Because if you know loser Larry's on, who can't intubate anybody on the first try, the minute they go in and hit it, it's going to slam shut. But you were the hero, not the zero. You have the trach set there for the doc to do the trach. Anything that's here, truction and truction and shake shack. Suction and trach set. Suction and trach set. Any question that has to do with your airway, if it's a thyroidectomy, if it's a carotid endarterectomy, if it's a thyroidectomy, parathyroidectomy,